Hazmat terrorist incident. This is a train station with a suitcase explosion with a white cloud with a dispersal device. Number one, I'll have to be sure that a rescue operation is plausible. I'll have to look for signs of multiple downed victims. I will have to determine if an atomized and mist nerve agent may have been used, and I will have to avoid all contact with any victims. As the first arriving chief's officer, I will decide on one of two modes of operation. One, is this a rescue operation? Or two, is this a defensive operation? If this in fact is a rescue operation, my first two companies will be forward operating officers, and they will be on a reconnaissance mission and can operate in the hot zone if proper personal protective equipment is used. Like I said, this mission is to get an idea of the number of casualties and should only be performed if there are likely survivors to be found. I'd have to do a risk assessment. I'd have to advise all other responders ASAP that this is a terroristic incident and to be aware of secondary devices when establishing their safe corridors. No other responders will be allowed in the hot zone unless ordered by the battalion chief. I will establish a command and designate the command post and request for all my additional resources I will need on scene. Safety officer, second and third alarm companies, a staging officer, hazmat, police for recon, crowd, and traffic control. I will have to take an appropriate head count of the ambulatory victims, and I will have to set up casualty collection points manned by ELS ambulances. The standard operating guidelines for this incident will include pre-fire plans, standard operating procedures, and target hazard reports that I will have at my disposal. I will, en route, get the wind and weather conditions so that I can set up in a safe area. I will prepare an effective route upwind and uphill. I will set up a safe distance and stage all units other than the first due engine and ladder companies. All explosions are to be considered terroristic incidents until proven otherwise. This, in fact, is a terroristic incident. There is a dispersal device. We have to check to see if it is still active. If it is, no rescue workers can enter that area. I will use binoculars and a PA system and use of blowhorns to communicate with the victims. All members will use full personal protective equipment, and they will first mask up and cover up all exposed skin. Latex gloves under the Kevlar gloves for added protection, and they will set up for mass decon operations. They will protect and decon civilians in place. We will cordon off the area and deny contact with the crew. One drop of this nerve agent can kill a first responder, so there can be no contact with the skin. Companies will use an 1 3/4 attack line for decon set to fog. Each additional engine company will stage and set up as an individual decon unit where they can also set up for the mass decon. There will be no cross. There will be no cross decontamination. Each engine shall set up individual corridors for decon in a safe area. Direct victims with a PA from apparatus or the use of a blowhorn. All streams to safeguard firefighters from any contamination. All members will be decontaminated before they remove their air supply system. They will prevent cross-contamination between victims with barrier tape of individual corridors. We'll have a timing officer to make sure that all members that are using their SCBAs to perform decon will have enough time to be decontaminated themselves before they be taken off their respiration. So, mass decon will be a coordinated effort, and the ladder company officer in this scenario would direct the wounded to safe zones via the apparatus and the PA system. The emergency gross recon and decon mission requires that 3 teams: 1, an entry team, which is the first ladder company; 2, the backup team, which is the first due engine company; and 3, the decon team, which is the second due engine company. All teams must be in full personal all teams must be in full personal protective equipment with air tanks on at all times. This while operating in the hot zone. Backup team dresses the entry team, then dresses for instant availability for a rescue emergency situation. And it assists in decon, alerting other responders immediately they must set up for mass decon operations. Decon team, each additional engine will set up in a safe area and be decon ready. They will set up in areas safe from exhaust from fans or systems from buildings. There will also be out of the paths of contaminated victims. Each engine company will have a 1 3/4 inch attack line for decon set to fog. They will have a resuscitator. They will have air and communication monitor, and they will have any known antidotes such as Mark I kits. In summary, I isolated the area and monitored the radiation. I established safe zones and defined perimeters. I facilitated ambulatory victims. I facilitated rescues as personal protective equipment and conditions permitted. I had set up a rapid triage, decon, and removal of victims. I set up for emergency gross decon operations. I obtained rapid classification of chemicals involved. I treated systematic with antidote as ordered by Medical Control Authority. I appropriated decon solutions for the situation. I coordinated and cooperated with other agencies. I indicated recovery operations. I initiated recovery operations. And I managed the consequences effectively. This is how I'll answer this question at this time.